In today's video, I'm going to be sharing with you a little bit about my own journey in breastfeeding with my toddler while pregnant and ways to help if you are experiencing breastfeeding aversion during pregnancy. Hey, it's Morgan. Welcome to the Passable Parent channel. I've been a pediatric nurse for the past 10 years specializing in early childhood development, and I'm also a mom. Before we get started, don't forget to like, subscribe, and turn notifications on so you don't miss out on any future videos. And make sure to comment down below if you have any questions. I'd love to hear from all of you. Thank you so much. I appreciate your support. Breastfeeding aversion is when negative emotions and feelings are triggered during a breastfeeding session. The emotions can span from irritability and frustration to rage or disgust. What's more, parents who are experiencing aversion report experiencing intrusive thoughts during bouts of aversion. Examples include, but aren't limited to, a powerful urge to stop breastfeeding, wanting to escape or run away from breastfeeding, thoughts of feeling touched out. These thoughts tend to stop when breastfeeding sessions end, although the stress from the experience can linger. Aversion isn't just emotional though, it's a physical component too. Mamas who experience aversion report an unpleasant skin itching or crawling sensation when their child is latched, along with an urgent need to remove their child from their breast. This can happen at any time in someone's breastfeeding journey, so make sure to also check out my comprehensive video on breastfeeding aversions. In today's video, I'm specifically going to talk about the breastfeeding aversion I dealt with during pregnancy and what helped me get through it. And mamas, this topic of breastfeeding while pregnant is one that I feel is not commonly or openly discussed. I really struggled at points during this pregnancy to continue breastfeeding my son. I know there can be a lot of judgment when it comes to extended breastfeeding, and just recently the American Academy of Pediatrics just updated its guidelines to encourage breastfeeding until at least 2 years of age, as long as mom and baby wish to continue. The American Academy of Pediatrics is finally publicly acknowledging the health and emotional benefits to your baby all the way to 2 years of age and beyond if you decide breastfeeding is right for you and your child. Sadly, even if many moms wish to continue to breastfeed, society does a poor job of supporting mothers and families with this, even in the first few months. So we have a long way to go, and it's important to remember that 1 in 4 women return to work within 2 weeks postpartum, so there is still a lot that is laughable about the amount of support for new moms in this country. This is my second pregnancy, and it has been very different than my first. I had lots of nausea my first trimester and even some vomiting. My first pregnancy with my son, I didn't experience any of these symptoms, so now I really can empathize with those of you experiencing these unpleasant symptoms and side effects. Towards the end of the first trimester and the beginning of the second trimester, I also started experiencing pretty severe breastfeeding aversions. It was horrible, and breastfeeding was something that I loved until this point, as it was something so beautiful that only I could do for my son and no one else could. And I felt as though the bond between us was just something so amazing and special. And while I still love it, I was confused and upset at the time with myself for having these feelings, and I didn't really understand what was happening to me. Then I did some research and I found out about breastfeeding aversions, which I had heard really very little about even as a nurse. And I found out that the main cause of them is actually your hormones, especially when you become pregnant. Here are some techniques that help me overcome my aversions. First off, I want to say if you are experiencing this, you are not alone. There is nothing wrong with you. You are doing an amazing job. The worst part for me was the guilt and confusion I felt, so if I can help one of you out there know that you are not alone and that you shouldn't feel this way, then that means the world to me. So the first thing that really helped me was talking to my husband. For you, this person can be anyone, but please find someone that you can talk to about this, who will offer you a non-judgmental ear, whether it's a partner, a friend, a spouse, or even your doctor. You shouldn't feel alone in this. There are so many women who this happens to. The second thing was that I started taking B6 vitamins. I noticed that my aversions to breastfeeding were worse when my nausea in pregnancy was the worst, which was all related to those pregnancy hormones I talked about. They were actually working to keep my baby inside my belly safe and growing strongly, but talk to your doctor about B6 vitamins and find out if they are safe for you to take in your pregnancy, because they are known to help with that nausea, which can also has a side effect of helping with those breastfeeding aversions. The third thing that I learned was that I really need to make sure I was getting enough rest, which is easier said than done when you already have a toddler. and that I was drinking enough water. Ask for support from someone you trust if you have anyone in your life that you can turn to in this moment to make sure that you're able to take better care of yourself. It's really hard when you already have another child or children and you don't get to rest as much as you did in that first pregnancy. So if someone can help out with your older children, you can really get some basic self-care in, and it really helped me. The fourth thing is to remember that this aversion is not your fault, and it is not your older child's fault who is still breastfeeding. Try to find and plan some fun activities for you and your older child to do together to promote that bonding and deepen your relationship. The fifth thing that I learned is that deep breathing exercises while the baby is latched or toddler can really help get through those aversions. So I would just take a nice deep breath in through my nose and hold it, and then exhale slowly. And that really helped during those uncomfortable times when I started feeling that aversion. And the sixth thing that I can tell you is to offer alternatives depending on your child's age if the aversion is just too strong in that moment to be able to nurse. So offer, depending on if they've started solids, you can offer them snacks instead. Very nicely just say, oh, here you go, here's some Cheerios, or one of their other favorite things if it's just too strong of an aversion in that moment. That way you're able to just get through it, give yourself a little break, a little grace during that time. And then the seventh thing that I wish I had really utilized more is reaching out to a lactation consultant. So you can fix bad latches, you can address those frustrating nursing behaviors, and they just really offer such great support and help parents figure out the best way to continue to breastfeed throughout pregnancy and potentially tandem breastfeed if that's your end goal. So I can't recommend finding a lactation consultant enough. They are such problem solvers and they have such great tips for you and solutions. And the eighth thing I can recommend is distraction. So when I was feeling an aversion, it was really much easier for me to distract myself doing something else during that time when my son was nursing or latching. So some ideas for that time would be to answer emails or watch TV or read a book or play a game on your phone when you're nursing, anything to sort of distract yourself from those aversions that you're feeling while your baby is nursing. It also can help to nurse in the company of other people if you're comfortable, to distract you, or nurse in a sling or a carrier so you can continue to move about, or even hold an ice cube or a hand warmer for sensory distraction in one of your hands to take your mind off of that aversion. And the ninth tip I have for you is that there is anecdotal evidence for using magnesium supplements to combat aversion. Some parents swear by magnesium enhanced creams and lotions, while others prefer supplementing in pill form. However, before you decide to supplement with anything, it's really important to clear all supplements you might take with your healthcare provider to make sure they are safe for you and safe for your pregnancy. I hope these tips were helpful for you in dealing with breastfeeding aversions during pregnancy. And make sure you subscribe so you don't miss out on any of my future videos on all things breastfeeding, child development, and giving your baby the best start possible in life. Thanks so much for your time and support. I'll see you in the next video.